Good afternoon. My name is Kenya, and I'm going to be delivering a speech about therapeutic communication. I know for me, every time I find myself in a conversation where the person I'm speaking with responds with, yeah, okay, and shows no other type of interest in what I'm saying, I usually just leave the conversation and tell them we can continue the conversation later. Because what is the point of having a conversation and there is no other thought that comes in from the other person? There's no exchange of feelings, no exchange of thoughts, nothing. And I know for my generation, what I know is that we dislike one word text answers with a passion. We do not like it when we text others and the other person only responds with one word. Maybe an okay, maybe a yes, but that is those examples are conversations that are lacking in active listening. The reason why is because we all like to be heard. Active listening not only allows us to open up about our deep feelings and thoughts, but in some cases it may be vital. For example, imagine how detrimental it may be to a patient who's in the ER explaining a scenario, and this patient's healthcare team, right, like the nurses and the doctors, are solely focusing on the present situation and not interested in hearing the situational background of said patient. For example, let's say an elderly woman who fell down the stairs, right? And the nurse and this patient comes into the ER, and the nurses and doctors are only worried about treating her fractured leg. But the nurses and the doctors are not listening to what happened. How did this woman end up falling down the stairs? Is this elderly woman living by herself, or is she living with other people? So is this a case of neglect or assault? Did somebody push her down the stairs, or she lives alone and she may need to be moved? It may be time for a nursing home. Or if she lives by herself, maybe this is a time to talk to maybe her children or nieces and nephews to come and step in and talk about how this patient can no longer live by herself on her own, right? I feel like these types of subjective data, right, could have been used as cues to deliver a much more accurate patient-centered care. So an example of our elderly woman or elderly patient who fell down the stairs, the more you know, the more you actively listen, ask open-ended questions, the more you can deliver a better care that is accurate and solely based on this patient. Now, the American Nursing Association decided to come up with a process that nurses can follow to communicate effectively with their patients. And this is called the process of therapeutic communication. This will not only raise patient satisfaction, but also promote patient-centered care and patient-nurse relationship, as this is extremely important, right? How the nurse relates to the patient, how comfortable is the patient to talk about what happened in their lives, or what from their history to what brings them to the hospital, what brings them to the ER, what is the situational background. This process, this therapeutic communication process, has three stages. It has the first stage, which is the orientation phase, the second stage, which is the working phase, and the third phase, which is the resolution phase. In the orientation phase, the nurse must set standards of the relationship, right? Like introducing yourself, explaining why you, the patient, the nurse, feel the need to have a chat with the patient. State the service you are offering. Be sure to let the patient know that confidentiality will be maintained, right? That nurse and the patient may have. The example could be, you could say, well, I need to ask you a couple questions, but no worries. This will only stay between me and you and the doctor if the doctor needs to know, right? That's what we have HIPAA in place for. And you use talk about the patient's chief of complaint, which is what brought the patient here, and use open-ended questions where possible to show active listening from what the patient states. Let's use, for example, a patient admitted to the hospital for a stillbirth, right? This patient, you're going to sit this patient down and you're going to introduce yourself as the nurse. Say, I understand you're here for a stillbirth. Like, is there any concerns that you may have? What brought you to the ER in terms of, did you maybe your water broke, or you're having unexplained contractions, pain that you don't know where the source of the pain is coming from in your pelvic area, things like that. And this process, in the orientation phase, you talk about your expectations, of course, the expectations from you as the nurse, and the expectations of your patient. You listen to the expectations of your patient. What does this patient want you to do? Or as the nursing team, or as the healthcare team overall, what is this patient's expectations of us? And the working phase is just that, right? It's the working phase. This is where the nurse implemented her nursing interventions for that patient. So in terms of the patient that we're talking about that is in for a stillbirth, now we would be administering Pitocin, right, to facilitate dilation of the cervix. Maybe we would run an IV bag, keep the patient hydrated, right? Patient can't eat, right? So we would, because the patient would be in PO as we wait for the birthing process to start. So maybe being attentive and making sure that patient has enough chips of ice chips, right, in their cups at all times to have something to chew on. Or it could be getting a priest, a minister, or a rabbi to come and bless this stillborn baby once this baby is delivered. Again, the working phase is what you are doing actively for this patient. And of course, still keeping a line of communication that all things are well. What is expected of you is being done, and that patient needs are being met. Lastly is the resolution phase. This is where the nurse and the patient relationship is closed and terminated. The nurse reviews with patient of goals if goals have been met. So as the nurse reflects or evaluates like his or her plan and figure out and determine if the nurse's goals have been met. For example, for me as the nurse, my goal for that patient is that when my patient has delivered her baby, I want to make sure that my patient at least gives me one positive statement, right? Because for me, that's my goal, because a stillbirth is such a sad situation, and for me, I would want my patient to state that the process was not that it was easy, right? But that she didn't go through the process alone, that I was there, and that she can state one positive note about the whole situation. That would be my goal. The patient goal can be anything from freed of pain, right? To maybe the patient states a rate of 3 from a scale of 0 to 10. Maybe that's a goal. And even for me too, as a nurse, that would be a goal as well. So we would talk about that. We would talk about what implementations, what interventions that I did, and how it affected the patient, whether positive or negative. And lastly, the last thing we would talk about is the plans for the future. So now that the patient is being discharged, what is next? For me, I know my patient absolutely has to go see her gynecologist, right? because we have to make sure that all is well in her uterus, right? That there is nothing left in there that can cause an infection. We have to make sure about that. And or maybe even seeing a therapist, right? Collaboration to see, to maybe she's definitely gonna need somebody to talk to. Sometimes people talk to people at home, so that's an also way to do it. Maybe she could have a conversation. Maybe she has support at home, but definitely make sure that there is support in place for this woman. And this would all be in the resolution phase. This is where everything comes together and you evaluate and you determine how effective were you with this patient. And that is the process of therapeutic communication.